Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This quick timeout is a short study break for disorders of the adrenal cortex, hypersecretion, and hyposecretion. We're going to start with some anatomy and physiology. We have two kidneys, and we have two adrenal glands, one on each of the kidneys. The adrenal glands have two parts. They have the adrenal cortex and the adrenal medulla. The adrenal medulla is the middle part of the adrenal gland, and it's going to secrete epinephrine and norepinephrine. If you want some more information on how that affects the body and resources covering the autonomic nervous system and pheochromocytomas, you can find that as well on the Pegasus Learning Platform YouTube channel. You also have the adrenal cortex. That's going to be the outside coating. The adrenal cortex secretes glucocorticoids. That sounds like glucose, so we're going to call that sugar. It secretes mineralocorticoids. Now, this particular mineralocorticoid we're going to talk about today is going to be aldosterone. Now, aldosterone tells your body hold sodium in water, so the more aldosterone you have, the more sodium you have. So for our QT today, mineralocorticoid is going to refer to aldosterone. It tells your body hold sodium in water, and the more aldosterone you have, the more sodium you have. So in this situation, we're just going to call it salt for convenience. It is actually, though, the mineralocorticoid aldosterone. So far we have sugar, salt, and then we're also going to have the androgens, which are sex hormones. So we're going to talk about hypersecretion of the adrenal cortex. You're going to have more sugar, more salt, more sex hormones. What happens to the blood glucose level if you're secreting more glucocorticoids? Well, it's going to go up. What's going to happen to the sodium level if you secrete more aldosterone? In this case, we're calling it salt. Of course, it's going to go up. And if you secrete more sex hormones, things like hirsutism or masculine characteristics might be something you see with your client. What would happen to the blood pressure if you're holding on to more sodium and water? It's going to go up. What's going to happen to your weight if you're holding on to more glucocorticoids and more mineralocorticoids to make you hold sodium? It's going to go up. With hypersecretion of the adrenal cortex, more glucocorticoids, more mineralocorticoids, more sex hormones, what labs would we monitor? Well, we would probably want to monitor glucose, sodium level. An appropriate diet would be, how about low sodium, low concentrated sweets? Some physical characteristics might include a round or moon face, hirsutism, which would be hair on the face. You might see a buffalo hump, which is excess fat on the upper back, truncal obesity, striae, thinner arms and legs. For hyposecretion of the adrenal cortex, decreased glucocorticoids, mineralocorticoid aldosterone, and decreased sex hormones. So what will happen to the blood glucose levels? They'll go down. The sodium level, it will go down as well. Sex hormones go down, and you also may notice bronzy pigmentation or hyperpigmentation for your client. So if the sodium goes down, what happens to the blood pressure? It's going to go down. What would happen to their weight if they have decreased glucocorticoids and decreased mineralocorticoids? That will go down as well. With hyposecretion of the adrenal cortex, what labs would we need to monitor? Well, the glucose and the sodium, because they'll be down. And I'd like to add that you'd also want to monitor the white blood cell count because they do not make enough glucocorticoids, which we need to help fight infection. An appropriate diet for this client might be fruits, vegetables, lean protein, calcium, vitamin D. They may also crave salt because they have hyposecretion of aldosterone. They're not holding very much sodium. Physical characteristics and manifestations might include that bronzy pigmentation or hyperpigmentation, sexual dysfunction, weight loss, hypotension, muscle aches, joint pain. They're also at risk for infection due to the decreased glucocorticoids. So again, monitor that white blood cell count. Here's some helpful reminders of the hormones secreted by the adrenal cortex: sugar, glucocorticoids, salt, which is actually aldosterone, the mineralocorticoid we're talking about today, and sex hormones or androgens. Monitor their weight, monitor their blood pressure, and definitely monitor their white blood cell count. Another helpful hint would be the more you secrete of sugar, salt, and sex hormones, the more weight you're going to gain. You get cushy with Cushing's. That's hypersecretion of the adrenal cortex. The less sugar, less salt you secrete, you better add some for Addisons. That's going to be hyposecretion of the adrenal cortex. This was a brief overview only. This quick timeout is for a short study break. Understanding Cushing's and Addisons involves more than this QT covers. Thank you for your attention to this resource from the Pegasus Learning Platform.